But yeah, do number one, it's to set a goal as a team for what you're wanting to achieve, how you're going to get there, review them often, maybe every 3 months, 6 months, and change tactics if it's not working. Everything keeps changing, so you've got to keep your eye on the ball. And number two is to do lots of, as much as possible, in-house training so that all the your vets, your nurses, receptionists all believe in it. We've spoke about this earlier. Look at, as a team, look at all the possible benefits that equine dentistry could bring to your clinic. Discuss it with the team. Could it be that they get the extra vet to their team that helps with doing more after hours? Could it be that one of the vets can go back to doing 2 days a week and they just come in and do dentals for those 2 days because they can be pre-booked? They know it's going to be a good return on investment for the practice, that sort of thing. Whereas that vet may not want to have their own practice out there. They might not want to deal with all the ATO and the record keeping and the insurances and all that. So I say to people who are thinking about leaving their practice, really try and find a way to stay there, because I think for our profession's mental health, we're better off being in tribes, and that's a basic human need to be part of a team. So it's pretty lonely out there going out solo, and I take my hat off to those who do. But if you can find a way to make it work in your team, that's going to be beneficial to you. And number four is to make sure every vet is taking an interest in every horse they get their hands on, take an interest in its mouth. It only takes 30 seconds to have a quick look at the incisors, have a quick feel of those second upper premolars, are they sharp or not, have a feel around there. But that's not only getting your mindset right into seeing they're all potential patients, but it's also showing interest, and the owner will notice that, I didn't know you were interested in teeth. Oh, really? Then they think about you becoming a potential, provider for their dental work. So it all starts with those little subtle things, but you need to be doing them consistently. And yeah, so things like carrots and sticks, not only for the employees, but also for the clients, offer them incentives to try and get them to try your clinic for their dental work. It might be, you might be doing a castration and say, look, I'll take these wolf teeth out of this colt on the ground for nicks. And then they'll say, I didn't know you did teeth. And then they say, the conversation starts, and then they might say, you did a good job there, so can you come back and do these other horses' teeth, and that sort of thing. So it's always trying to incentivize owners to use you. And it doesn't have to be financial. It might just be an extra 30 seconds of your time, or, a free sheath clean or something like that. It doesn't take much, but you want to be finding that point of difference that can help them sway towards choosing you compared to someone else.